Okay, so I'm going to talk to you a little bit about the human services budget this year. And I don't have any animals. I do have some wonderful staff with me, though. Angie Hicks, Denise Henderson, and Dee Bolden in the back there. So I did bring some of my wonderful staff here. We have, in the Department of Human Services, 1,194 city full-time employees. Oh, I'm the clicker person? Okay. Thank you. 1,191 full-time staff in 4 divisions and a $135 million budget. Now, we also have contract staff and part-time staff that we add to this, so we're about 1,500 strong in reality. As you know, we have had some challenges with vacancies this year that we have tried to fill. We have a hiring bonus program, thank you very much for helping to support that has brought in 53 staff. So that's a good number since last October, November when we started the program. But we're still challenged with filling all of these vacancies. And when you're challenged like that, who's picking up the load? Well, it's the staff that are continuing to be there. So we have a lot of staff that are working overtime or actually doing double duty, wearing multiple hats. Everyone in the agency is doing a very big lift right now to make sure that our programs keep running and that our services keep going. And so I do want to say, a big thank you to them today, but also a big thank you to you for providing them with a raise last year and that bonus. It was really appreciated. I heard a lot about that from the staff members, so thank you very much, all of you, for doing that. Okay, and in this slide, I should also mention the 4 divisions. There's 60 programs across 27 locations in the city. So we're huge. We're across a lot of different locations. Okay, the budget for BHDS and administration is about $78 million of this. As you can see in this slide, the developmental services amount of this budget is the biggest. It's 37% at $28 million. Behavioral health is $25 million, 33%. And then the other parts of the budget are a little bit smaller. But we added in the administration part to the BHDS side just for purposes of this slide. That would include my CQI, HR, IT. Social services is a $56 million budget. Biggest parts would be your Children's Services Act, your Children's Services, that's where your child welfare is, investigations, ongoing, foster care. Benefits eligibility, and adult services. That's also where we have adult protective services. We do have JDC in there at 11%, and just some other employment services, that'd be your TANF and VIEW. Okay, so our budget is going up just a little bit this year. We did go up in staff, as you're aware of, because the state provided us with some different program amounts for, such as the Marcus Crisis Program, Forensic Services, our PSH program, and peer services. So we did get some staff from the state this year, as well as some ARPA funds, which helped us out. And within here, we also have, of course, your VRS part, your additional part for staff, and the big part of it would be, though, the state lift there. Okay, I put this slide in here so that I can tell you a little bit about our strategic plan. I like to talk about this plan because it's a very active plan for us. We put this plan in place way back 6 years ago, really, almost at this point. But in 2018, we refreshed it. And everything that we do that's going to come after this slide in our major initiatives and things that are programs and services that we do are going to fall into one of these categories. We make sure of that. We talk to our boards about it every month. Where does this program fit? Where does this service fit in our strategic plan? And we're refreshing it all the time. So our plan goes through 2023. A good portion of it is going to fall into integration and access to services. We want to make sure our citizens have the best access to service, the most timely access to service. So a good portion is going to fall in there. But we do a lot around community engagement. We don't want to forget that. Our prevention folks are out there frequently doing events and doing other engagement activities in our community. And then talent acquisition and development is critically important, especially for clinical positions. You want to make sure that they are continuing to get that education and be able to go to conferences and see some of the innovative therapies and things that are going on. Okay, so the social services side, some of the changes and initiatives that we have there is, I'm not sure that everyone is aware, but we serve about 92,000 citizens of Virginia Beach. So if you think we have about 460,000 citizens in the city, we're serving almost a quarter of them in the Human Services Department, just in social services and the benefits area. They're getting some combination, whether it's Medicaid or SNAP, which is your supplemental nutrition program. So 92,000. The staff in this area have been challenged, of course, with vacancies. A lot of them have done a lot of overtime. They have worked incredibly hard to achieve what is remarkable, and I'm going to show you right here our March statistics. What they call level 3 agencies would be your big agencies in the state of Virginia. So you're talking Fairfax, Prince William, Henrico, Chesterfield, Richmond, places like this. And we ranked in March with the vacancies and the number of applications that we had to process, third highest for meeting the non-expedited target. Non-expedited target is within 30 days you're processing that application. Expedited is within 7 days, so you're moving very fast on those. And we ranked second, so we were only behind Fairfax and Prince William. And when I say to you, Fairfax has like a whole training academy. They have a lot more staff than we do, and they do a lot around this to make sure they don't miss anything in any of these applications. We're working on that. We're hiring a little bit more in terms of our training staff. But this is phenomenal, so I wanted to share that with you because you should be really proud. And I'm really proud of the staff and what they've done. Okay, so in child welfare, we did have 37 adoptions in 2021. We're always working towards permanency. We always want those children to find that permanent home. So 37, and we already did 3 this year. So all the time, that is a key initiative for the staff that are working in this area to make sure that they're working that through the court process and working with the families to make sure we find the best families and the best fit for these kids so they can have a permanent home. 313 kids were still followed post-adoption. What do? We see them at least annually, but lots of times more often than that. We're helping them through the FAPT process. We're helping them through any crisis or therapy services that they need. So we're always following these kids. 177 kids are still in our foster care program, and 29 kids are in our fostering futures, which is the 18 to 21-year-old range. In adult and aging, we have 237 active APS cases. APS is Adult Protective Services. So if there's a fear that they may be exploited, neglected, or somehow abused, we're involved for your senior citizens, as well as your disabled individuals who are adults. 878 clients are receiving guardianship, and 61 are receiving companion services. Okay, the mobile food pantries. This was an initiative that actually came from council. You dedicated some money to the Southeastern Food Pantry, and then they worked with us to put on these big events, these big mobile food pantry events. And it's every time when we do these, we pray for no rain, of course, but every time when we do these, it's really the leaders and I that are out there. We have the rest of the staff can join us if they want to and if their jobs will allow it. But for the most part, it's the leaders and I out there, and a lot of other help from police, Public Works, the amphitheater lends us the amphitheater, and we have a ton of volunteers. It takes really quite a lot of people to run one of these. The last one was in March 29th. It was freezing cold that day, if you recall. That was the day, the coldest day of March. But we served 1,530 people, 1,530 households, and that means 60 pounds of food per household. So that's just one of these events. Most of them are somewhere between 1,400 families and 1,700 families. Overall, over 8,564 households have been served this year, which is really great. And the folks who come through there are the most kind and thankful people. They truly are. They're very thankful to all of you, too. They want to make sure that you know how thankful they are that we're doing this as a city, and it's not done in every city. Okay, so BHDS, Behavioral Health Developmental Services. What are some of the new services this year? Well, we opened up an office-based opioid treatment. That was back in November, actually, but it really lifted off in 2021. Marcus Alert went live in December, as well as our mobile crisis hubs. In the Marcus Alert, we're partnering with 911, 311, 911 for the most part, to make sure that the 911 operators know that they can defer these calls that are behavioral health emergencies to us. And about 150 calls since we went live have been deferred, so police didn't have to go out to these locations, and they could go right to a behavioral health expert. So we're helping out with the entire public safety and public service here by deferring and working with our 911 to do that Marcus Alert program. We are one of 5 in the state. I believe you're aware of this, and so that's pretty remarkable. Angie is over this program, and she has done an incredible amount of work to help lift it off, so I'm very appreciative to her. In the crisis hubs, we were able to lift them off with actually the pathway staff. So I do have, that's the news that is actually rather sad in my presentation. We have not been able to open pathways crisis services again. We closed them in November, didn't have enough nurses. I provided a little bit of information to you on that. And we still haven't been able to hire the nurses. The nursing and the medical component of our agency is extremely competitive. Very hard to hire these folks. So we're not quite there yet. So those folks are working in the crisis services. We moved all the staff around so that they'd have a position, and that's really helped to move this program forward. Expanded services, permanent supportive housing got 50 more slots. We were actually asked to take more slots because we do such a remarkable job. So now we have 122 slots total. And so they looked at Virginia Beach and they said, you're doing phenomenal with the first group. We know you need more staff to do this. We're going to give you more staff, and we're going to give you more slots. So, again, a credit to our team, our staff, and our leaders here in this agency. Forensic discharge, we got 3 more positions to help with that, with folks coming out of the jail. And drug court has expanded. We got a grant, and we have expanded that, so we're going to be able to serve more people through the drug court process. Okay, so this is our ask. This is really what we want to talk about a little bit today, and I'm going to have Angie tell you just a little bit about it as well. So Angie's job actually is over in the P6 building. Her location is there. This is a picture of the P6 building. We have all 4 of the floors, but we don't have the 5th floor. The 5th floor has always been some other agency or someone else has occupied it. What we'd like to do is move over another location where a lease is coming due, move those services into the 5th floor, and then have like a one-stop shop where we add more services. People can just go up and down, whatever they need in one day, as opposed to going to some of our other locations. I mentioned we have a lot of locations. And that can be difficult on people for transportation. So this is what we'd like to propose to you. It will help with the one-stop shop, but also increase our engagement and just our continuity of care. So I'm going to invite Angie up here to tell you a little story about one of the clients. This is one of probably 300 stories she could tell you about, but I'll let you tell them about one person in particular, just to kind of give you a picture of this.
Welcome. Thank you for coming.
Thank you, sir. Good afternoon, everyone. I would like to share a story with you, a story about Lane. Lane is a 26-year-old woman who, as a child, experienced severe sexual and physical abuse. That trauma prevented her from developing adaptive coping skills and forming the type of healthy, trusting relationships that we all were fortunate enough to form. In addition, she was diagnosed with bipolar disorder, and over the years she's had severe episodes of depression and mania, distorted thought patterns, and thoughts of ending her life. With the lack of treatment and ongoing stressors in Lane's life, her symptoms worsened. She began to self-medicate with opioids and alcohol. She was disenfranchised from her family, and eventually she became homeless. She was living on the streets. She was going in between shelters. So at a point in her life where things were very rough for her, she was hospitalized 3 times over the last couple of years, but she never followed up with outpatient care upon discharge. When she finally came through same-day access at Pembroke 6, she was coming out of her 4th hospitalization after a severe overdose and attempt to end her life. The same-day access clinician completed her assessment and clearly identified complex needs for Lane. Before addressing her trauma and the need for therapy, we needed to get her with a physician for medication to stabilize her symptoms, and we needed to help address some of her most basic needs. These are things that we sometimes take for granted, but many of the people who seek help with us do not have their basic needs met. So we referred her to crisis management, housing supports, and case management services. Currently, those 3 services are located at different sites. Now, we all know when we try to navigate the healthcare system, it can be difficult. And we would all most likely prefer to have most of our services in one location so that you can go from point A to point B very efficiently. But for someone like Lane, who was in crisis and feeling hopeless in her life and quite frankly questioning whether our services could make a difference for her, it truly had an impact not having services in one location. And in fact, we had difficulty re-engaging with her after that first appointment. It took a team of people looking for her. So the Pembroke 6 expansion is an opportunity for us to streamline some of these core mental health services. And for Lane, what that would have meant is that after that first appointment, that intake clinician could walk her up to the 5th floor, put her in touch with a crisis stabilization clinician, a peer specialist, and a housing specialist, and they could start working on some of those basic needs right away. And in addition to just meeting those needs, another thing that's important to mention to council is that that provides a rapid engagement. It's so important for this population because it builds trust, and it also builds value in the services that we can offer, and that's what keeps people coming back when they're sick and engaging in services long enough that they can get well. People who are symptomatic and struggling with their basic needs are not able to navigate a fragmented service system. So this opportunity to integrate services at P6 will allow people like Lane to get the help that they need faster and to avoid any type of delays in care which could lead to negative outcomes. So I will point out before I leave that Lane was just one of 1,100 individuals that sought our help last year and came through same-day access. Many more stories like this. Thank you for giving me the opportunity to share that.
Thank you. All right, any questions at all?
I have a question, just have a
Yeah,
comment.
John.
And I know Michael's been out there, and I congratulate him for doing that at the food bank when they've been out there, but that has been, I have heard feedback from people in churches and around the community, what a great program that is. And that was the sad news that came from the agricultural department, because the bigger food inflation is to come.
Yeah.
What we think we've seen is a small measure of what we're going to see going forward. And so your department, I appreciate all you do to make sure that those families, at least to some extent, lessen the stress of not being able to have food at their home.
Thank
you
you.
very much.
Yeah, they're very thankful, and they know that council was a part of this too, and that we're one of the cities that does this, that there are very few actually. Even when our state office came down from Richmond, she visited one time, she said, "We're not doing this in Richmond." Congrats, so thank you very much for that. And Mr. Bellucci is out there. He's almost directing traffic with us, so he's just a full-on partner with it. So thank you for that too.
Okay, Barbara, then Mike, and then the traffic director.
The expansion is underway, or is that something that we have to approve?
That would be for your approval.
Okay, so.
Not underway.
That's your number one ask this year, okay?
Yes, ma'am.
And what would be the timeline on having it in place?
Well, if I would say probably 6 months to a year. I mean, it's going to take a little while. And so we haven't put it that far because we're waiting to see, where this lies with you. And then after that, I would say any of our expansions have taken around 6 months because it takes a little while. We have to renovate, make it fit for us, and then move. But it actually, for this purpose, if we were going to do it, we would have to put it in place very quickly to get that other lease, move out of that other lease. So it would be, within that 6 month period.
Okay, good.
Thank you. Michael, and then Linwood.
thank you, Ms. Smith, for being here and for your presentation. And you're very kind to say that about me. I've had a chance to visit distribution, but certainly, actually, you're the one directing traffic, and I think a lot of people don't realize that. Yeah, that the Director of Human Services is the one. But I see you there, and your team too, senior leadership on the ground, doing everything that needs to be done to make sure those programs are successful. So I want to compliment you on that, and I think it's really just impressive and remarkable operation that, you're right, is supported by Public Works, Police Department. Last time I was there, I saw incredible volunteers from the U.S. Navy
Right.
doing some heavy lifting, which I'm sure was welcome relief. So it is a great partnership, and it's something that we're all very proud of, and I want to thank you for that. And I just do want to say hi to Angie and Dee and your other staff members here. I'm sorry your name escapes me for the moment.
Denise.
But Denise, good to see you. And thank you for being here and for the incredible work you do. You know, this portfolio represents our most underserved, most at-risk residents. And it's because of the work that you do and also our nonprofit partners and many others that Virginia Beach is consistently ranked as the most caring city. And I think that's a reflection of the investment that council and it's really just our whole community makes in terms of providing services and attention and compassion to people who are in need
Right.
for whatever reason. So having said all that, I do have a couple questions.
Certainly.
One is related to the Pathway Center, and I appreciate your acknowledgement of the fact of the challenges that you're having there. And you know, addiction is an element of mental health. As you know, that's something that has been very important to me. And providing services to people who are facing issues related to substance use and addiction and all of those elements of mental wellness is critical to avoid things like interaction with law enforcement and then the spiral that results from there. So anyway, that's a long way of saying it's really important we get that center up and running. As from what I understand, I don't know a lot about the program there, but
Yeah.
I know addiction services are crucial to the health of our communities. So how do you think we can, I mean, what's the next step?
So Angie and I have been working on a plan, a recruitment plan for really the whole program, but in particular the nursing, because we have to have nurses there 24/7. And so we need a robust cadre of nurses. We can't just have one or two nurses trying to carry that torch. And so we're working on that, and we plan to put something forth to be a little bit more competitive. I would compliment City Manager Duhaney, who has been incredibly supportive of everything that I've done. Thank you so much. And everything that I put forth in terms of just being more competitive in this field, and especially in the medical area. As you know, we're in competition with not only the other CSBs in the area, but Centera and places like this. And Centera, you know, recently had announced $125 million in bonuses and incentives to their staff. So we're always trying to do what we can to be that employer that we want to be and that is competitive.
I think you talked a little bit about the crisis centers, and can you describe kind of how you have adjusted your operations to compensate or maybe possibly mitigate the impact of closing the Pathway Center? So let's say someone in crisis or a family member is seeking the help that they would be needing from the Pathway Center, but they're connecting with the city. So what happens then? Since the pathway, you would normally direct them to the Pathway Center.
Right.
Since that's not open, now what?
Well, it depends on the level and the intensity of services that they need. So our same-day access that Angie mentioned, where about 1,100 people have come through this past year, usually that's the gateway to do that assessment, to do that evaluation, to figure out, oh, you may need something more intense than what we can provide. And then we would be referring them to an inpatient place, an inpatient opportunity, such as VB Psych or somewhere like that. But if it's something outpatient, something that we can manage, then we're going to pull them in through our services and put them into our clinic.
I think one of the, and I thank you for that. I don't know what the answer is. I'm not asking these questions with any specific outcome in mind, other than that when people are seeking help, they need it right then and there. And so, the fact that we have some challenges, and maybe I actually have little confidence that there are other resources in the community that would compensate for our lack, because everyone's facing the same
Right.
challenges. But maybe there are some creative ways we can work around it. I don't know. I'm happy to be supportive of any ideas that you have. But it's just, I think it's so critical that we connect people with the services they need at the moment that they're seeking them. Otherwise, we lose them, and then they're going to end up in jail or worse or do. So anyway,
Very
it's
true.
been on my mind, and it's something that I'm concerned about, and I think we need to address as soon as possible. So thank you very much.
Correct.
And Michael,
Correct.
thank you for your passion in this regard.
Absolutely.
Linwood,
Thank you, Mayor. So I want to go back to that consolidation discussion you were having, because that makes a lot of sense to me. So can you kind of explain to me what would need to happen for that to happen?
You're talking about the P6?
Yeah,
Okay.
P6.
So we have programs that are over at one of our other locations, obviously, and that location's lease is up in December. And so what we would look to do is move over everything that's in there and put it on the 5th floor, but also create a way that we can have hoteling there for staff, because we're expanding our staff, but we're not expanding our buildings. We got 28 new staff this year from the state, but we didn't go and ask for another building or another location. What we're trying to do is use telework and other ways that we can have them come in and out of the buildings, have a place to stop, load up their computer, do that, or see a client in a private space, because we have to have, HIPAA compliance. And so see a client in a private space. So how we would build that out would be that we would have a ability to move over. It's more square footage. So we'd have the ability to move over the programs that are currently in that other location, but also create that leverage for us so that in the future, we're not coming back and asking you for any more space. We're doing more of consolidation because more and more people are teleworking. So we've kind of put it through those type of avenues, and when we thought of how it might look, what we might do there. It wouldn't just be office space that is the exact office space of where we were. It would be a way that we can bring in more staff and have them have an ability to be in a building where like programs are, or where they can connect the client to some other program.
But you said this isn't in the current budget proposal?
No, it is.
It is?
Yes, this is my ask. This is
Oh,
my big ask.
So
Yes.
if we vote on it, we're good.
Yes.
That's all I want to know.
Linwood, I like the way you cut to the chase, my brother. Yeah,
got
John.
it.
You mentioned, and it's across the board, that maybe if we had more money or more spaces, the certified people aren't out there to hire. I think there's more demand than there is supply. So my thought process was, it would seem to me like this is a regional problem, that if everyone, and I don't know how it could work, but other places that solve these issues hire people that aren't yet qualified, and they hire those people on the condition that by X period, they get their certification, and the agency then helps pay the instruction and all the things that go with that. Because if you've got to build supply, then you're going to have to organically build it. I don't know if you've looked at those options.
Oh, yes.
Or if the region's looked at those options. But I think this is not just an acute, this is a structural shortfall. I think you would concur, and therefore it requires some kind of, like in the military, you hire all these basic recruits, but you manufacture yeomen, you manufacture weapons people. We're going to have to manufacture bring these people through a process and get them the certifications and hire them without them, I think.
Right. Right.
And I hope that that is part of your strategy, and I think that should be really a regional approach, because everyone benefits, and I think Tidewater should be, or some with Norfolk State or ODU, I don't know how all that works to get all those certifications, but that really is a regional
It is.
mission.
We do a lot. We have a regional training committee that's helping to support that effort. But then the other thing that we do, and I'll use child and youth as an example, they supervise people towards their license. So we need more licensed people. So the licensed people who are able to do that help to give them those hours. They work for us, and we're getting them towards that license. So we definitely are doing that.
Right.
It's incredibly important to grow and be able to support people in training and getting that certification. You're right.
Thank you very much. Thank you, Mr.
Barbara.
Just a very quick comment. Yesterday afternoon, I had the opportunity to meet with Neva, who is working on our sustainability plan update, and she sort of gave us an overview of the comments in those community conversations that we had, 3 groups. And she said the thing that had added this time that they had not heard in previous times was a great concern for mental health. And that was just across the board from all of the groups that we had. And so I think one of the things that certainly occurred from the pandemic is that we've all begun to recognize these issues. And you have to recognize you've got an issue before you can resolve it. But I just thought you might like to know how high that was on the list of concerns that our public brought to us. And so I think they're really looking for us to do something. So,
Certainly. Yeah, the isolation can bring on depression,
Right.
using substances, all of that. And so that is definitely something that's been on our minds as well, and we've heard it
need to
too.
address these things. So I think, it's certainly something that people are aware of now, and now's the time that we need to do something about it.
Correct. Correct. Thank you.
Yeah, Sabrina.
So thank you very much for your presentation. It's certainly a heartfelt thank you for serving the families in need through those outreach programs that you provide, and certainly have had an opportunity to attend and participate. Hope to do more of that because I think it's essential. But in terms of the P6 expansion, when I hear about all of the perhaps the incentives or the help associated with putting everything in convenience of a one-stop shop, can't help but think about a family that I have been working with who has a son who had a tumultuous experience due to some behavioral health issues, and he was certainly rerouted to several places, ended up in jail, and the experience that he had was just unthinkable. Can't help but think of if we had something of this nature, how perhaps the devastation and the experience that he had would have possibly been diverted. And so I certainly support that expansion in hopes that we are able to really help divert individuals who need that assistance to the right people and the resources, because there are a lot of stories, specifically that story that I'm familiar with in the family, that are still reeling and hurting from the experience that they've had. And we have not talked to all of the departments and institutions that were a part of that situation. But we hope to, and hopefully the solution will be, I know it's going to be a strategy. The strategy is going to be multi-pronged. But out of that solution, I'm hoping that we would at least have these kinds of resources. We're going to have to address legislation because that's an issue as well. But again, I do certainly support that expansion, and I would like to see issues like the one that I'm working with really end in a better way for people who have behavioral health needs.
Certainly.
Yeah.
So would we. Mr.
Thank you for all that you do and
Rocky.
your staff.
Director Smith, I couldn't let you go away without saying the Lord's work you're doing in the Correctional Center, and we appreciate it. You're making a huge difference, and I think as you track those numbers and the statistics we've had in the jail, helping the incarcerated has been unbelievable. And I've even heard that we're a model program throughout the Commonwealth with what we're doing. So let your people know we surely appreciate it, and it's making a big difference in a lot of folks' lives. So
Yes.
thank you very much.
Thank you very much.
Yes, ma'am.
Thank you very much.
And Aileen, let me close out by saying, the gratitude that I believe we have for you and your staff. Being a healthcare provider for a couple decades, back in the 90s and recently, I had to use your services, especially APS and, being in people's homes, and you see it all. But I think what folks have to appreciate, that as the ills and challenges of society exacerbate, it falls directly upon you. With increases of fentanyl, with, and all the opioids and the amount of depression and everything, and we really doing that. And, I think John Moss hit on a point that we're gonna need some collateral help, to give you a hand. And we got a couple things. We met with the director of the secretary of Public Safety and Homeland Defense the other day, talking about violence issues. And the one thing we really talked about was the identification that a lot of violence, especially youth violence, is related to mental health issues that, we just got to embrace the problem that we really haven't done before. And, we have an idea commission that hopefully, we're going to start giving you the resources of putting many of the faith-based community together that you could help at least form a bridge but once again, when you think about it, and, we just got to be honest, your responsibilities are pretty much cradle to grave. You cover everything.
Correct.
And you cover the biggest challenges that are out there. And in a city of 460,000 people, when you think about the monumental, challenges and responsibilities that you had, and COVID didn't help, it exacerbated things. You have done, you and your staff, a remarkable job, and we thank you.
Yes, they have. Thank you. Thank
Okay.
you very much.